lots of drama, lots and lots of drama. So it makes sense why in dialysis it's a lot more men. Hey guys, welcome back to my channel. I am Nurse Fifi, also known as Fifi or Leah, Leontine, whatever is convenient for you. Today I want to talk about the biggest the biggest myth about nursing and nurses. And I'll also reveal to you guys what it's like to be a nurse behind the scrubs. I have been a nurse for not too long, but I'll tell you guys based on what I've heard and the things that I know, okay? So let's dive in. There are a lot of myths and opinions out there for people who are not nurses or maybe have a family member or friend who's been a nurse. So there's a whole bunch of things that people think about nursing. So I actually have them written down so I know exactly what I want to talk about. I don't want to get off tangents. One of the biggest myths is that nurses only have to work 3 days a week. I have friends who tell me, you're so lucky, you only work 3 days a week. But the truth is, it depends on where you work. It depends on your unit, or if you work at a hospital, nursing home, private duty. There's a whole bunch of nursing departments or route you can go in as a nurse. And so those will have their own schedule, or I guess they'll depend on the manager too. So most of the time, if you work at clinics, most clinics close either on Fridays or Saturdays. So, and they usually close also in the evening around, I think 8 o'clock, but they don't have nighttime unless they have an urgent care. But most clinics close early, which means you're probably not going to have night shift nursing positions. Compared to if you work at the hospital, then the hospital run 24/7, especially the emergency room, 24/7. So because of that, they're going to have day shift nurse, night shift nurses. I've heard of places who have 10-hour shift and 12-hour shift. I also know about nursing homes, for example. They have 8-hour shift, 10-hour shift, 12-hour shift, and I've heard of a 16-hour shift, which is crazy to me. So nurses, we don't only work 3 days a week. It depends on where you work and your specialty and what you chose. The other myth that people think is nurses, all we do is give medication and follow doctor's order. Even though that is true, there is more. We do more than just that. We have to advocate for patients. We have to sometimes talk or communicate with the patient's family members, the ones who are bedside or non-bedside. There's some other administrative work that needs to be done. So if you heard nurses say they have a lot of charting to do and they leave late, that's one of the other things on top of just giving meds and following doctor's order. So we do give meds because it's a hospital or you're dealing with sick people, so they're going to need medication. But on top of that, we just have a whole bunch of other tasks that we do. So we're not just there for one thing. We have patients sometimes who have behavioral issues. They're not necessarily on a behavioral floor. So on top of every other jobs that we have to get done, we need to also pay attention to a behavioral patient, which is a whole other thing. So we do a lot more than just giving meds and following orders. The next myth, nurses make a lot of money. I've heard of this almost every day, or at least once a week. At least once a week. Personally, I've experienced it. I have friends who go through that. I hear on lines and all of that. So people think we just walk around making money and traveling and doing all these fun things because we make a lot of money. Unfortunately, social media have not helped in that, because there are nurses who do make a lot of money, but they also do a lot of other things other than nursing, or they just do a lot. Their money is not coming from just going to work Monday through Wednesday or Monday through Friday and then they make that kind of money. So again, a lot of things in nursing is always going to refer back to what floor or what units you work at, what hospital or what facility you work at, what specialty you work, your experience. All of that is going to play into factor. Nurses have different salaries. They all have different salaries, just like any other job. Depending on your experience, you may get paid more. So yeah, we don't make a lot of money, although there is a lot of money to be made in nursing. Travel nursing is one of the greatest one. During COVID, I know people made a whole bunch of money. Like some people even retired during COVID or after COVID because of how much money they made. But we also lost a lot of lives during COVID. So just depending on the situations, yes, nurses do make a lot of money, but not all nurses make a lot of money. I want to make sure that is clear, because you see these curtains in the back? Yeah, if I had money, it wouldn't be like that. Okay, fine, let me know. Yeah, don't know. Okay, the other myth that I've also heard is that nursing is for women. That is so not true. Although there's a lot more women in the nursing field, nursing is for everyone. It doesn't depend on your gender or your race or I don't know, whatever. Anybody can be a nurse. And so yes, you will see a lot of women who are nurses. I'm a dialysis nurse now, and most of my coworkers are actually males, which is I'm honestly I haven't been used to that. I usually have worked with both, and they're usually either the women are more or like equally the same, but this is the first time I'm actually working a lot with men. And so, which I think with dialysis, that's a whole other topic for another day. But with dialysis, a lot of the time you're working one-on-one or by yourself. You're on your own pretty much. And so whereas like a regular med surg floor, there's a lot more nurses, so lots of chit-chatting that happens, and cliques, and lots and lots of drama. So it makes sense why in dialysis, or at least the setting I'm working in, it's a lot more men, because men just like to keep things going and they have their own sort of drama, but it's nothing as close as women. I know I said it. Okay, that is all I have for you guys today. There's a lot more myth that people have out there about nursing or nurses. I'm trying to keep this video short. Let me know if you guys want a part 2, then I will. If not, thank you guys for following through. Please like my video, subscribe, and comment, and I will see you next time. Thank you. Bye-bye.